35-year-old Ibtisam Jabora sells tea and food in Khartoum's shabby market. She makes a profit of about $5 or less in a day. This is barely enough to put food on the table for her 6 children.
I work hard to provide one meal for my children, and it's not even nutritious. When I was pregnant, I suffered a lot, and my kids were sick for years. Nobody cares about women here.
A new report by UNICEF reveals the global food crisis is deepening the nutrition crisis for adolescent girls and women, especially in Africa. And Sudan is one of the hardest hit countries.
The number of women and children who suffer from malnutrition in Sudan is among the highest in the world. The situation is worsened by inadequate dietary intake, low incomes, and limited access to food.
The long political and economic unrest in Sudan, coupled with the long dry spell, has affected food production. According to the UN, malnutrition undermines women's productivity, ability to look after their families, and capacity to generate income.
Many Sudanese families cannot provide their food needs, and this causes malnutrition. It's dangerous for women, especially pregnant women, and has effects on their health and their infants' health. If we cannot provide a balanced diet, we must refer to food alternatives. Organisations and governments must support these groups to provide suitable food.
Most of the girls and women here are forced to work in order to feed themselves and their families. And with very low incomes and the recession in the market, the situation is unbearable.
The UN is now urging governments and their development and humanitarian partners to strengthen nutrition and care practices for adolescent girls and women everywhere. The aim is to improve access to nutritious diets and essential nutrition services for women like Ibtisam Jabora and her children.